Hello guys, this is Indian Medico and in this video we are going to discuss about phakic intraocular lenses. Phakic IOLs are basically lens-based refractive surgeries. Phakic IOLs are used in patients who still possess their natural lens. They are useful for high myopia, typically greater than 10 diopters when laser techniques are inappropriate due to inadequate corneal thickness or inadequate residual stromal bed depth. It is useful in younger patients with high ametropia but intact accommodation. In highly ametropic older patients, we do refractive lens exchange. This is because in them accommodation is lost. Coming to the models of phakic intraocular lenses, the first type of phakic IOLs are anterior chamber iris fixated phakic IOLs like Artisan or Vericis, which is manufactured by AMO. These lenses are clipped to the front of the iris via two claws, as you can see in this picture. It corrects -5 to -20 diopters of myopia. The second type is Visian ICL, that is Visian implantable Collamer lens, which is manufactured by Star. It sits in the posterior chamber, as you can see in this picture. So peripheral iridectomy is performed to prevent pupillary block. It corrects myopia from -3 diopter up to -20 diopter. The third type is angle supported phakic IOLs like Acris of Cachet. In this, the phakic IOL is placed in the anterior chamber and is supported by haptics in the angle. It requires an anterior chamber depth of greater than or equal to 3.2 mm. It corrects -6 to -16.5 diopters of myopia. However, angle supported phakic IOLs are withdrawn from the market due to excessive endothelial cell loss. Coming to the advantages of phakic IOLs, they have a larger treatment range compared to laser treatment. Now let us discuss the disadvantages of phakic IOLs. Phakic IOL is an intraocular procedure, whereas laser refractive surgeries are not intraocular procedures. Phakic IOL removal should be done at a later stage when cataract surgery is needed. In phakic IOL, we work in a small anatomic space, so sizing is much more critical than for posterior chamber intraocular lens. Phakic IOL is not suitable in patients with shallow anterior chamber. For phakic IOL, sequential one eye surgery is recommended compared to bilateral laser refractive surgery at one city. Now let us discuss the complications of phakic intraocular lenses. Phakic IOL cases have increased risk of cataract formation. They have a potential for endothelial cell loss and there is a very low risk of endophthalmitis in phakic IOLs. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. Thank you.